Hi students, welcome to HSC Biology and Module 7, Infectious Disease. In this video we're going to be talking a little bit about herd immunity. Our goal is to interpret data relating to incidence and prevalence of infectious disease in populations, for example mobility of individuals and the portion that are immune or immunized. So what this does is it allows us to introduce this concept of herd immunity to get you to understand some of the effects of herd immunity and the importance of high mobility on incidence and prevalence of disease, and perhaps how these two things can work together to either reduce the incidence of infectious disease and keep them under control, or actually to increase their prevalence. So there's been a bit of a push for increased vaccination for some years now. In fact, the World Health Organization in 1974 launched the expanded program on immunization. The aim of this program was to increase the percentage of the world's infants immunized against 6 key target diseases: diphtheria, tetanus, whooping cough or pertussis, polio, measles, and tuberculosis. What we've seen in the years since then is that vaccination is now regarded as one of the most successful public health programs used to prevent disease. One of the things that I can't encourage you strongly enough to do is to look at the science around vaccines and infections, especially at the moment when we've got some recalls on the COVID vaccines as a result of some issues with blood clotting. It's really, really important that you look at the science of all of this. There's a lot of people with a lot of opinions, and the fact that you've been vaccinated doesn't make you an expert on vaccination. And so one of the things that we want to look at is some of the changes. We want to start analysing data. We want to see how data changes. One of the key bits of data is that the result of this initiative from the World Health Organization was that from a percentage of 5% in 1974, just a couple of decades later, 23 years later, we increased that percentage to 80% of all infants immunised. And this prevented around about 3 million deaths each year. And of course, this is one of the challenges with immunisation, is that it's actually been such an incredibly successful program that a lot of the diseases that used to be really horrible in childhood have almost been eradicated. And therefore, we don't get exposed to them, we don't see them, we don't see our children suffering with them. And as a result of that, I think sometimes we've just become a little bit removed from the real benefits of immunisation. We're just focusing sometimes on some of the potential side effects or the occasions where some people don't respond well to vaccination. One of the reasons this is important, apart from the fact that we have a population now that is very mobile, a lot of young children are not always in the care of one or both of their parents. Often they're in childcare facilities from quite young ages, which means they're mixing with other children, all sorts of different children from different backgrounds, and we don't have any way of guaranteeing that there's any levels of vaccination in the group. So what we try and do is we try and encourage this idea of herd immunity. Now, the idea of herd immunity is basically to think about what happens as the proportion of people within a population are immunised, as that proportion increases. Now, we know, we've already seen, the statistics are telling us that mass immunisation programs do prevent disease occurrence, but one of the things that they also do is they can decrease the spread of disease. Because once the majority of the population are immunised, the chance of an infected individual coming into contact with someone who has not been immunised is very low. And so therefore, if there's a small number of people in the population for a number of reasons that do not undertake vaccination, then the high majority are still going to protect those individuals. The fact that so many people are immunised are still going to protect the small number that are not. But as that number increases, then this benefit of herd immunity starts to break down. So what we want to try and do with herd immunity is to protect individuals, but also to minimise the transmission of diseases from one individual to another. And herd immunity is a way of being able to effectively stop that, or at least reduce it significantly in incidence. That said, a lot of people still choose not to vaccinate. And one of the important things about science is that we do want to base our decisions on the facts, but we also want to understand the situation that different people are in. And there's lots of reasons rather than just a doubt over whether or not you think vaccines work or whether they're safe, sometimes when children are due for a particular vaccine, they're unwell. Most medical professionals will tell you, will assess the child first and tell you if the child is not well, then exposing them to a vaccine is probably not a good idea. And so therefore they may miss that particular one. There is a percentage of parents that are anti-vaccine for various reasons. Sometimes there's logistical barriers. There may be reasons why you can't get your baby to a vaccination clinic. Certain people are born overseas. There may be certain cultural, there may be certain factors that may affect why they have not chosen to vaccinate or why they're not able to vaccinate their child. Sometimes there are medical exemptions, and there may be other reasons as well. So this was a poll on vaccination perspectives from Australian parents in 2017. And of course, these sorts of things, the Australian Bureau of Statistics will also provide data on vaccination rates, immunisation rates, and these issues, particularly in light of COVID, are continuing to come up all the time. So it's important to keep an eye on what's going on in terms of vaccination and why people are still doing it, and why certain people are choosing, for various reasons, not to. A little graphic, I guess, just to reinforce this message of why herd immunity matters, because there's two important issues here. One is about mobility, and one is about vaccination, or more broadly, immunity. Because the whole idea of vaccination is that people are carrying around the antibodies, or at least their immune system is already triggered to a particular disease. So if you have a large number of people in that situation, then the chances of two susceptible individuals coming into contact with one another, and particularly if one of them is carrying the pathogen, significantly reduces as you increase those proportions. Now, there's two ways to increase the chances of two susceptible individuals running into each other where one is affected. And that is, one, if those individuals are highly mobile. So if there's lots of movement, and a movement can be things like travel, they can be immigrating or emigrating. Or it may well be that things like childcare, maybe not even the same childcare, maybe childcare that's involving a few different individuals, maybe parents, grandparents, other family members, babysitters, as well as childcare centres. All of these can increase the mobility of the child and increase the chances of that child coming into contact with perhaps an infected individual if they themselves are susceptible and not immune. Increasing the proportion of individuals who are vaccinated is obviously going to increase that pool. So if you're looking at the immunised and healthy individuals as being these little yellow ones, then you can see that ideally for a society, we want to have a large number of these yellow individuals where we have healthy individuals and we also have individuals that are going to basically protect the individuals that are not immunised but are currently healthy from those who are infected. So it's partly about how those infected individuals are going to get access to healthy individuals in order to cause the disease. Think about Koch's postulates again. But this time in the natural setting where you're going to, to put it bluntly, allow individuals who carry the disease to potentially pass that on to others. Now, every time we're sick and we go out in public, we go to work, we do anything, we are running the risk of transmitting that disease onto other individuals. The more that we think about how we can minimise that, which may be as simple as staying home, which may be covering our mouth or our nose if we're coughing or sneezing, keeping away from more susceptible individuals, either those with lowered immune systems or those who have not been vaccinated. All of these sorts of things are measures that we can take to try and help keep the incidence of certain diseases low. And that's what we're about, looking at some of the different effects, some of the different ways that we can try and control and manage infectious disease and keep the incidence and prevalence figures as low as possible. Thanks for watching.